Welcome to the training session on updates to the person-level COVID-19 vaccination forms for long-term care facilities. My name is George Segovia, and I work with the Division of Healthcare Quality Promotion at CDC.
And my name is Sushmita Anand, and I'm a contractor working with the Division of Healthcare Quality Promotion at CDC. Today, we'll be reviewing the updates to the person-level COVID-19 forms in the long-term care component for both residents and healthcare personnel. Now, I will pass it over to my colleague, George, who will discuss some of the updates.
Thank you so much, Sush. May 11th of 2023 marked the end of the federal COVID-19 public health emergency declaration. However, long-term care facilities participating in CMS quality reporting programs will continue to report to the healthcare personnel and resident weekly COVID-19 vaccination modules of the long-term care facility component on a weekly basis. As a reminder, NHSN provides a pathway to report data, but is not a regulatory or enforcement body. Please direct any questions and/or concerns regarding reporting requirements and penalties or fines to CMS using the email addresses provided on this slide. The objective for today's webinar is to review the changes to the person-level COVID-19 vaccination forms for long-term care facility residents and healthcare personnel. Throughout the presentation, we will have an in-depth review of the upcoming form changes, the up-to-date definition change, provide example scenarios, and answer frequently asked questions. Please note, the slides from today's session will be posted to the NHSN COVID-19 vaccination website in the coming weeks. The form changes and up-to-date guidance discussed today will be available to users as of June 26, 2023. On April 19, 2023, the Food and Drug Administration announced changes to its emergency use authorization regarding COVID-19 vaccines. Following this announcement, CDC simplified COVID-19 vaccine recommendations. These changes include CDC's new recommendation allowing for an additional updated bivalent vaccine dose for all adults ages 65 years and older, and additional doses for individuals who are immunocompromised. This allows for more flexibility for healthcare providers to administer additional doses to immunocompromised patients as needed. Monovalent original mRNA COVID-19 vaccines will no longer be recommended for use in the United States. CDC recommends that everyone ages 60 years and older receive an updated bivalent mRNA COVID-19 vaccine, regardless of whether they previously completed their monovalent primary series. For purposes of NHSN surveillance, beginning on June 26, 2023, residents and healthcare personnel are considered up to date with their COVID-19 vaccinations if they have received an updated bivalent vaccine. The form changes and up-to-date guidance discussed today will be available to users as of June 26, 2023. For access to information on all of the FDA changes and resources specific to NHSN, please follow the links on this slide and in the chat. As a reminder, long-term care facilities can choose to submit cumulative weekly COVID-19 vaccination data on healthcare personnel and residents in one of three ways: directly into the data entry screens of the COVID-19 vaccination modules, through CSV file upload into the weekly COVID-19 vaccination modules, or by using the person-level COVID-19 vaccination forms and selecting the View Reporting Summary and Submit button to submit the data to the weekly COVID-19 vaccination modules. The focus of today's presentation will be on option number 3, the person-level COVID-19 vaccination forms. NHSN has offered training webinars about the person-level COVID-19 vaccination forms. For those that may have missed these training sessions or need a refresher, let's review a few main points about these forms. The person-level COVID-19 vaccination forms are optional tools that can be used to report data to the long-term care, weekly healthcare personnel, and resident vaccination modules. They are available in the NHSN application. SAM's Level 3 access is required. To request access, please email nhsn@cdc.gov and place in the subject line SAM's Level 3 access. The advantages of the person-level COVID-19 vaccination forms include the application calculating and entering weekly cumulative totals, determining who is up to date based on vaccination dates, and organizing and managing facility data. Now, we will review the updates to the person-level COVID-19 vaccination form for healthcare personnel and residents. First, we will begin by reviewing the healthcare personnel COVID-19 vaccination cumulative summary form that appears after clicking on the View Reporting Summary and Submit button in the person-level COVID-19 vaccination form for healthcare personnel. Question number 1 of this form remains the same, which records the number of healthcare personnel that were eligible to have worked at the healthcare facility for at least 1 day during the week of data collection. Question number 2 has been updated to only record healthcare personnel in question number 1 that have received complete primary COVID-19 vaccine series at this facility or elsewhere since December 2020. Question number 2 will no longer record healthcare personnel in question number 1 that have received partial primary COVID-19 vaccine series. As a result, the person-level COVID-19 vaccination form will automatically classify healthcare personnel in the unknown other vaccination status category if they have only received a monovalent Moderna or monovalent Pfizer vaccine for dose 1, have not received any other vaccines, and have not had a medical contraindication for reporting weeks beginning on June 26, 2023. This categorization will be discussed in further detail in the upcoming slides. Question number 3 remains the same, which records the number of healthcare personnel that have a medical contraindication to the COVID-19 vaccine, were offered but declined COVID-19 vaccination, or have unknown other COVID-19 vaccination status. Please note, specifically for healthcare personnel, medical contraindication, declination, and unknown other COVID-19 vaccination status are possible reasons as to why a healthcare worker has not received complete primary series COVID-19 vaccination. Question number 4 has been updated to record the cumulative number of healthcare personnel in question 1 who are up to date with COVID-19 vaccines. We will review the new up-to-date definition beginning on June 26, 2023 in an upcoming slide. Please note, the summary totals on this form are automatically calculated based on the data entered in the person-level COVID-19 vaccination form. Next, let's review the resident COVID-19 vaccination cumulative summary form that appears after clicking on the View Reporting Summary and Submit button in the person-level COVID-19 vaccination form for residents. Question number 1 remains the same, which records the number of residents staying in a facility for at least 1 day during the week of data collection. Question number 2 has been updated to record the number of residents in question number 1 who are up to date with COVID-19 vaccines. Please note, the resident person-level COVID-19 vaccination form will no longer record residents who have received partial or complete COVID-19 vaccination series. We will review the new up-to-date definition beginning on June 26, 2023 in an upcoming slide. Question number 3 has a definition update. Previously, residents having a medical contraindication, declining COVID-19 vaccine, and unknown other COVID-19 vaccination status were possible reasons as to why they have not received complete primary COVID-19 vaccine series. However, since the resident cumulative summary form is no longer recording residents who have received complete primary COVID-19 vaccine series, this definition has changed. Now, having a medical contraindication, declining COVID-19 vaccine, and unknown other COVID-19 vaccination status are possible reasons as to why a resident is not up to date with COVID-19 vaccination. This definition change will be discussed further in an upcoming slide. As a reminder, the summary totals on this form are automatically calculated based on the data entered in the person-level COVID-19 vaccination form. The next few slides will demonstrate the updates to the person-level COVID-19 vaccination form for healthcare personnel and residents. Please note that many of the updates being made to the person-level vaccination forms are the same for both the healthcare personnel and resident forms. However, there are a few differences between the healthcare personnel and resident person-level vaccination forms as a result of these updates, which will be highlighted and discussed in further detail in upcoming slides. Although the images on the next few slides depict the healthcare personnel person-level vaccination form, the same update is also applicable to the resident person-level vaccination form. First, we will discuss the updates to the Dose 1 vaccine manufacturer name and Dose 2 vaccine manufacturer name data fields in the person-level COVID-19 vaccination form for healthcare personnel and residents. The images shown here display the two new options that can be selected from the drop-down box of the Dose 1 vaccine manufacturer name and Dose 2 vaccine manufacturer name data fields. These two new options are updated bivalent Pfizer vaccine and updated bivalent Moderna vaccine. The updated bivalent Pfizer vaccine and updated bivalent Moderna vaccine options can only be selected if corresponding dose date is after April 19th, 2023. The Pfizer COVID-19 vaccine and Moderna COVID-19 vaccine options can only be selected if corresponding dose date is on or before April 19, 2023. These changes come as a result of the FDA's authorization of bivalent vaccines for all doses on April 19, 2023. The Is Vaccination Series Complete data field will be removed from the person-level COVID-19 vaccination form for healthcare personnel and residents. The image on the left-hand side of the slide displays the current person-level form with the Is Vaccination Series Complete data field present, and the right-hand side of the slide displays how the person-level form will appear once this data field has been removed. The unknown COVID-19 vaccination status date data field will be updated to unknown or other vaccination status date. Facilities should continue to enter a date in the unknown other vaccination status date column if a healthcare worker or resident's vaccination status is unknown. As a reminder, this date can be the same day as their start of employment date or admission date. As discussed previously, because the healthcare personnel COVID-19 vaccination cumulative summary form will no longer record partial primary COVID-19 vaccine series, the person-level COVID-19 vaccination form will automatically classify healthcare personnel in the unknown other vaccination status category if they have only received a monovalent Moderna or monovalent Pfizer vaccine for dose 1, have not received any other vaccines, and have not had a medical contraindication for reporting weeks beginning on June 26, 2023. Please note, this change is applicable only for the healthcare personnel COVID-19 person-level forms. The images on this slide show an example of this concept. On the left-hand side of the slide, a healthcare worker has received a monovalent Pfizer vaccine on March 26, 2023. This healthcare worker has not received any other vaccines and does not have a medical contraindication. As a result, this healthcare worker is counted under the unknown other COVID-19 vaccination status category, as shown on the right-hand side of this slide. Users should continue to enter both the dose 1 date and the medical contraindication date, as the person-level forms will auto-classify these healthcare workers accordingly. The additional booster dose date, additional booster dose type, and additional booster dose manufacturer data fields displayed on the left-hand side of the slide will be updated to dose 3 date, dose 3 dose type, and dose 3 manufacturer data fields, respectively. This change is displayed on the right-hand side of the slide. This is simply a relabeling and will not impact the data that you have already entered. Because the concept of boosters has been phased out, and the COVID-19 vaccination cumulative summary will no longer record booster dose receipt among healthcare personnel and residents, the term boosters has been removed from the person-level form. Additionally, if a date is entered in the dose 3 date data field that is after June 26, 2023, the dose 3 dose type data field will no longer be required. The red asterisks that have been associated with the dose 3 dose type data field have been removed to reflect this change. The booster dose 2 vaccination date and booster dose 2 vaccine manufacturer name data fields displayed on the left-hand side of this slide will be updated to dose 4 date and dose 4 manufacturer data fields displayed on the right-hand side of the slide. Additionally, the booster dose 3 vaccination date and booster dose 3 vaccine manufacturer name data fields displayed on the left-hand side of the slide will be updated to dose 5 date and dose 5 manufacturer data fields displayed on the right-hand side of the slide. Once again, these data fields are simply being relabeled and will not impact the data that you have already entered. Because the concepts of boosters has been phased out and the healthcare personnel and resident COVID-19 vaccination cumulative summary form will no longer record booster dose receipt among healthcare personnel and residents, the term boosters have been removed from the person level form. The booster dose 4 vaccination date and booster dose 4 vaccine manufacturer name data fields displayed on the left-hand side of the slide will be updated to dose 6 date and dose 6 manufacturer data fields displayed on the right-hand side of the slide. Additionally, the booster dose 5 vaccination date and booster dose 5 vaccine manufacturer name data fields displayed on the left-hand side of the slide will be updated to dose 7 date and dose 7 manufacturer data fields displayed on the right-hand side of the slide as well. Now, I will pass it over to my colleague Sush, where she will discuss additional updates and then answer some frequently asked questions related to the new updates.
Thank you, George. As a reminder, the updates discussed earlier for person-level form for healthcare personnel and residents are similar. However, there are a few updates that are applicable to only residents or healthcare personnel. Now, let's review a few updates to question 3.1 to 3.3 for person-level vaccination summary form for healthcare personnel and residents that will be in effect June 26, 2023 onwards. For person-level healthcare personnel, these questions would be applicable to those that have not completed their primary vaccine series. And for person-level residents, these questions would be applicable to those that are not up to date. As a reminder, we want to emphasize that when using the person-level vaccination forms, the application automatically summarizes data you submit into the correct categories in the vaccination summary form. So you do not have to worry if an individual should be counted under 3.1, 3.2, or 3.3 question, as the application will automatically categorize it. Now, let's review question 3.1, medical contraindication to COVID-19 vaccine from the person-level vaccination summary form. There are no changes to person-level healthcare personnel. However, for person-level residents, the application now allows entry to have date of medical contraindication to be greater than date of prior doses. We will provide more information in the next few slides. The image shown on this slide shows an example of the new update that will take effect. Here you can see the medical contraindication to date to be greater than dose date of prior doses. Now, this is because the medical contraindication question for residents now means a medical contraindication preventing the resident from being up to date. This could occur after several prior doses. Please note, previously we could only have medical contraindication only after first vaccine dose. Question 3.2, offered but declined COVID-19 vaccines. There are no changes to person-level healthcare personnel. However, for residents, now decline date can be greater than prior dose dates. Now, this is because the declined question for residents now means declined the vaccination to be up to date. This could occur after several prior doses as well. If no bivalent boosters have been received and decline date to be greater than prior dose dates, an alert will pop up asking you to confirm that the resident declined the vaccination to be up to date. We will provide more information in the next few slides. As shown in the resident person level COVID-19 vaccination form image, decline date is greater than prior dose dates. And in this example, particularly, no bivalent boosters have been documented. Hence, the application will provide an alert. The alert shows this individual has already received prior vaccines. Please confirm that this individual declined the most recent dose needed to be up to date. As you can see from the image on the slide, users can click OK to confirm and remove this alert. And also for person-level residents, if the resident is not up to date and decline date is the only date entered in the person-level vaccination form, then it is counted in the decline category. And now for the question 3.3, unknown or other COVID-19 vaccination status. For person-level healthcare personnel, if someone has only monovalent Moderna or monovalent Pfizer for dose 1 and no other vaccines and no medical contraindication, they are counted in the unknown or other vaccination status category for reporting weeks beginning June 26, 2023. And also note that for earlier weeks, they're counted as partial primary series. And for person-level residents, if prior doses received, but no bivalent vaccine and no medical contraindication or decline date, they are counted as unknown or other. As a reminder, we want to emphasize when using person-level form, the application again automatically puts the data you submit into correct categories in the vaccination summary form. So again, you do not have to worry if a person falls in 3.1 to 3.3 question, the application will automatically display where each person will be categorized. Up-to-date definition change. Now, let's review the up-to-date definition change for both residents and healthcare personnel reporting. Please use this definition beginning with Q3 of 2023. As stated earlier, on April 19, 2023, the Food and Drug Administration announced its emergency use authorization regarding COVID-19 vaccines. These changes, following this announcement, CDC simplified COVID-19 vaccine recommendations. These changes include CDC's recommendation that everyone ages 6 years and older receive an updated bivalent mRNA COVID-19 vaccine, regardless of whether they previously completed their monovalent primary series. For NHSN specifically, beginning on June 26, 2023, which is Q3 2023, residents and healthcare personnel are considered up to date with their COVID-19 vaccinations if they have received an updated bivalent vaccines. The form changes and up-to-date guidance discussed today will be available for users as of June 26, 2023. Now, an individual is considered up to date once they have received one updated bivalent Pfizer or bivalent Moderna COVID-19 vaccine. This up-to-date definition is the same for all individuals, regardless of age and immunocompromised status. Please note that this definition may change over time. Therefore, facilities should refer to the definition on the first day of the reporting quarter. The CDC NHSN team will be posting a document to the NHSN website with the current definition of up-to-date. And users should review this document at least once per quarter to check for definition updates. Now, if you're using person-level form, the application will automatically consider the most up-to-date definition and will summarize your data appropriately. Scenarios. To help understand this change, let's review various scenarios about the new up-to-date vaccination question added for both residents and healthcare personnel reporting. Scenario. Is this individual considered up to date with COVID-19 vaccines for Q3 2023? So the first one we have is we start with Mary, who is a nursing home resident who completed a primary COVID-19 vaccine series in May 2021. As you can see first from the first image, those were the completed primary vaccine series in May 2021. And Mary also received an original monovalent booster in October 2021 and an updated bivalent dose on November 3, 2022, as shown in the second image. This scenario has been entered into the person-level COVID-19 vaccination form for residents, as displayed again on the images on the slide. Now, is Mary considered up to date with COVID-19 vaccines based on Q3 2023 up-to-date definition? The answer is yes. Mary is considered up to date for the weeks during Q3 of 2023 since she received an updated bivalent dose. Again, we want to emphasize and highlight that when this information is added using the person-level vaccination form as displayed, the application will automatically summarize individuals into correct categories in this vaccination summary form. In another scenario, we have healthcare worker Mark completed his primary vaccine series on January 18, 2021, and received an additional dose in June 2021, and an updated bivalent dose in October 2022. The scenario has been entered into the person-level COVID-19 vaccination form for healthcare personnel, as shown in the images on the slide. Now, is Mark considered up to date with COVID-19 vaccines based on Q3 2023 up-to-date definition? The answer is yes. He is considered up to date with COVID-19 vaccines for the weeks during Q3 of 2023, since he has received the most recent recommended bivalent dose. Again, we want to emphasize and highlight that when this information is added using the person-level vaccination form as displayed, the application automatically places the individual into correct categories into the vaccination summary form. We will now review some frequently asked questions for more general FAQs and example scenarios. These will also be included in the FAQs posted in the NHSN website. So the first question we have is, when do the new form changes take effect? Beginning June 26, 2023, that is Q3 2023, the updated person-level form changes will take effect. At this time, please use the new up-to-date definition when reporting COVID-19 vaccination data through NHSN. However, when using the person-level form, the application automatically considers the new up-to-date definition and will categorize the data in the vaccination summary form. Question 2. With PHE ending, do long-term care facilities need to continue reporting COVID-19 vaccination data? If so, how often? Yes, as mentioned earlier, weekly reporting of COVID-19 vaccination data for healthcare personnel and residents through the long-term care component COVID-19 vaccination modules will remain required for CMS certified facilities following the ending of the PHE on May 11, 2023. Please note that COVID-19 vaccination data should continue to be reported weekly for residents and healthcare personnel. Once again, we remind you to please direct further questions and/or concerns regarding reporting requirements to CMS for further information. Question 3. If a 66-year-old who has received a recommended bivalent dose in September of 2022, but no other doses, are they considered up to date? Yes, per NHSN's definition, they are considered up to date. Please note, individuals who are 65 years of age and older or immunocompromised are eligible to receive additional COVID-19 vaccine doses because of the clinical benefit, but it is not mandatory. Whether or not the individual receives additional bivalent doses, they are still up to date. Question 4. If a resident has only monovalent vaccines for dose 1 and dose 2 and had a medical contraindication after dose 2, how is this resident classified in the vaccination summary form? The answer is they would be classified under 3.1 medical contraindication to COVID-19 vaccine of the vaccination summary form, since the medical contraindication prevents them from being up to date with COVID-19 vaccine. And again, as a reminder, one of the benefits of using person-level form is that once data is submitted into the form, the application automatically categorizes individuals into the correct categories. Lastly, we have summary of updates and changes. Let's summarize the main changes done to the person-level COVID-19 vaccination reporting form that we reviewed today. Those include up-to-date definition on vaccination status that has been revised. Residents and healthcare personnel are considered up-to-date if they have received an updated bivalent vaccines. For residents in particular, COVID-19 vaccination data will no longer be reported for primary vaccine series and any additional or booster doses. For healthcare personnel, it is important to continue to report on the primary series, but no longer booster doses. Resources. We will now review how to access the additional resources that are available to facilities. The long-term care component website contains links to a variety of resources and training materials, including quick reference guides, training slides, and information on CSV upload. If you have any questions about NHSN, please send an email to usersupport@nhsn@cdc.gov. Please include in your subject line person-level COVID-19 vaccination form along with your facility type. This concludes the presentation. Thank you so much for your time. We will now have the opportunity to answer questions.